I am Anna Rempe, and I am from the Coleman area, and I'm an accountant here in Brookings, South Dakota. In my family, I have 3 daughters. My oldest is Evelyn, my middle daughter is Emma, and then my youngest is Ella. And recently, we just added a son, little Elliot. I absolutely loved it because I work here in Brookings, so it was way more convenient to pop over here, especially later term, you have so many more appointments. So then to only go to appointment for like 10, 20 minutes. So then before I was driving an hour to Brookings or to Sioux Falls. And so to be able to just pop here was like super nice and convenient. And then, it seemed to go pretty fast too. Like you could just pop in, and then if I had to do other imaging and stuff like that, they could always schedule it pretty fast here in the Brookings Hospital. So yeah, altogether it was very convenient and very personable, and yeah, I had a great experience. Through this whole experience, she's listened to everything I've said, and to me, it seems like she always like goes above and beyond. Even like with the induction process and everything, coming to check in on me multiple times. And even when I was getting close to delivery, that's when Elliot's heart rate would keep dropping or whatever. And she was right in there right away. And so to me, she must have been like close, like by. It was just such a nice feeling knowing she was always there. I was induced with Elliot because I had preeclampsia, and I've had preeclampsia with 2 other pregnancies I've had previously, so I kind of knew what was coming, but this was the first time that I was induced at 37 weeks. Very different because going into the bigger hospital, it's a lot of waiting, especially when you get in a planned induction. You kind of have to wait in the admissions area for quite a while. I felt like and you're so excited to go have a baby, but then you're just kind of waiting. And then you get into the room, and then you're in a delivery room, so you feel like you don't want to take all your stuff because it's a lot of stuff. So I know my husband, as we had more kids, would kind of leave stuff in the car until we got into our postpartum room. But then at the same time, we also had an experience where we were stuck in the delivery room for a while. So then we had to go get all of our stuff, bring it to the delivery room, and then bring it all into postpartum. So it was nice this time around to just have everything in one spot and be in the same room the whole time. In Sioux Falls, when the doctor comes in, it's like 20 people come in at the same time. Well, here it was way more intimate because it was the nurse that I had, because when you're induced, you have a nurse in the room all the time with you. And so it was her, and then when she said it was about ready time to push, then that's what I was assuming was going to happen. All of a sudden, there was going to be like 20 different people in the room. But what actually ended up happening is my doctor came in, and then one other nurse came in. And I'm assuming that nurse was for Elliot, like the baby nurse, and that was it. So like during the actual delivery of Elliot, there was only 3 people, like 3 other people in the room. And it made me feel like more calm, because when all of a sudden you have 20 people in the room, you think like something bad is going to happen, and nothing ever does, because then they slowly fizzle out. But when you just have 2 other people enter the room, you stay calm, collective, and like you just stay focused more, and you're not like, whoa, 20 people, versus you just keep in the mood of like, I gotta push this kid out, So it was quite different, and I wasn't expecting that. So I definitely enjoyed my postpartum experience better at this hospital than I did in the previous ones, just because of the bigger room, the big windows. You didn't feel like you were in like a little like cave. And I think that's what made my mood even better, because you're like excited, because you're up all night anyway, so you get to watch like the sun come up, and even like the sun going down. It kind of helps you get into more of like that routine of like night and day too. So That's the one big difference is like you have these huge windows, and that you did not have that at the previous hospital. It was like this one little teeny window. My preeclampsia decided to stick around. So at first it wasn't enough to keep me in the hospital. They did end up discharging me. And then I would have to come here for blood pressure checks. And then it never ended up kind of fizzling out. So what ended up happening is 2 weeks later, I got readmitted to do a magnesium drip. And I think since I had such a good positive experience the first time, even though it wasn't ideal to like get readmitted after you just had a baby, I was actually kind of looking forward to seeing some of the faces again, and just like having like another set of hands, like, and especially having 3 other kids at home, it kind of was nice to come back. So I would say my recovery was a little bit crazier, but I definitely felt fully supported. And like I said, even having to come back, I was somewhat a little bit excited. I would tell them that you do not need to drive to Sioux Falls, because this is such a great hospital right here in your local community. And it makes it so nice if you have family here already, and especially if you have your children here. It's so nice to be within minutes or even a half an hour away, you know. Then you're able to just drive here and come here and have that small town feeling, and people like greet you with a smile on your face, and you're like, you feel like you've been here like your whole life. But definitely you don't get that type of feeling when you have to go to Sioux Falls, because you're just you're just kind of more of like, I don't want to say a number, but you're a patient there, versus like you kind of feel like your family here. And quite honestly, it's a little bit funny because Elliot is probably our last child, but we always said we wanted 5 kids. And so now I'm kind of poking at my husband and saying like, hey, I only had 1 in the Brookings health system, and it would be nice if I had all of them, or even like, I was like, let's just have 1 more, because it was such a good experience.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.